this video, we will explore the process of breaking bad news in the clinical setting and the provision of education and support for carrying out this role. Bad news can be described as any information that changes a person's view of the future in a negative way. There is a need for effective communication in healthcare, and this is especially salient for patients facing a frightening diagnosis and an uncertain future. In cases where it is required that we break bad news, we must do our best to see the situation from the patient's eyes. Having empathy and good communication skills will go a long way in ensuring the patients can process the news, and without becoming too distressed. In the time leading up to the consultation, the patient will likely have spent a lot of time worrying about the test results and can be quite anxious already. We must approach the situation in a relaxed, caring manner and acknowledge that the patient may already be distressed.
The diagnosis of cancer. Did you suspect that that may be the diagnosis that you were going to meet when you went to the hospital?
I did. I knew what was coming, I thought. I went for my mammogram, and they took quite a few x-rays, which had me thinking. Then I was told I was going for an ultrasound, and I could see them ticking, and I knew they were measuring something. But it was the way that the doctor that was doing the ultrasound, my mammogram hadn't come through from the other imagery department, and she was speaking to a nurse and she was quite anxious to get it, and from that alone I knew she wants to see it for a reason. If there was a sense of urgency about it, she said, I need that right away. And I was watching it, I could see it playing out, and I knew there was something coming. And then when the biopsies were being taken, I know biopsies can be benign as well as malignant, but my gut, from what I was seeing around me, I knew there was bad news coming.
A professional may meet with their patients once or many times throughout treatment, each having a different setting and dynamic. The diverse ways in which a professional engages with the process illustrates the complexity of their role. It also highlights the wide range of knowledge and expertise needed to be able to deliver this care. The second challenge is relationships. Ongoing relationships with the patients and relatives are a unique dimension of the role of the nurse in breaking bad news in the inpatient care setting. The process may strengthen the relationship but may also have negative effects, particularly when divergent views were held by the professional and the patient or their family over the disclosure of bad news or the patient's plan of care. Conflicts of views can have detrimental effects on the patient-professional relationship, and it is important to be aware of this. The third challenge is lack of control. Lack of control can occur in a stressful situation which escalates quickly, such as an aggressive or abusive response to bad news. This can make it difficult to give information or care to the patient. Due to the unpredictable nature of healthcare, professionals encounter situations which they cannot control. To minimise these occurrences, we must emphasise the need for a calm and organised approach aided by preparing for the event, being knowledgeable about the patient's situation, creating an environment which ensures privacy, and ensuring the consultation is structured with a clear beginning, middle and end. A helpful acronym is the SPIKES approach to breaking bad news. S for setting the scene, P for perception, I for invitation, K for knowledge, E for emotions, S for the strategy and summary. Audrey was kind enough to talk again about her journey after her treatment had finished. We asked about the good bits of care and who was most helpful in giving her useful information.
I suppose the good bits were my oncologist. I always praise him and his registrar. They've been fantastic, very approachable, very much concerned about how I'm getting on. I can call them and they'll always contact me straight away if I've any anxieties or any concerns about anything. They've been fantastic on the journey. The nurses in the oncology unit, when I'm in the day centre, they've been great. I can pick up the phone and ring them at any time. They've been very helpful. But funnily enough, it's the other patients that I get a lot out of when I'm in treatment, like their side effects. And I might be a week ahead of one person and I'll come in and I'll say, oh, my nails are starting to lift, it could be something like my nails are going brown, they're starting to lift. That person won't experience that, but then she'll come in with the same complaint the next week. Somebody's a week ahead in the journey, and they're kind of advising you what could be coming next. So I got a lot of my knowledge from the actual patients themselves when we're sitting around for hours on end discussing it, which is, I know that's unusual, but, well, it's not unusual, but I got more, I suppose, from the other patients than I did from anybody else, because you've so much time with them.
Giving bad news is a difficult part of clinical practice and may take a deal of time to learn. While on placement, you must listen to and observe your senior colleagues and tutors, but most of all by talking to patients and asking about their experiences. Here are some links to further learning. For more information and resources on this topic, please visit the following address.